computer. Fabulous. Yeah. Great. Okie dokie. So yes, welcome. We're going to be looking at this topic of route to healthy skin. I'm your host, Dr. Sally Bell, and we have a guest with us, Dr. Catherine Steele, who I'm going to introduce later. And we're really going to be looking at skin from the inside out and from the outside in. And for those of you that don't know me, I'm a medical doctor. I've been a doctor for 22 years. And about halfway through my career, I have changed the way I've practiced. I got a bit tired of treating diseases and not people, and treating symptoms and not getting to the root of why people are unwell. And over the years, I've developed a practice where I try to get to the root of why you're unwell, personalising health, and use a team of health coaches to coach people back to health. And I have a small clinic. I do a lot of sort of online teaching because my heart really is to give people agency over their health. And we do these webinars. I'm a wellbeing advisor for the British Army and for the Michelin-starred Hampton Manor. And my heart and big passion is around food, and having people have access to real food. And so just before we go on with today's topic, just let me tell you about the one that's coming up. And that's in 2 weeks' time. And I've got the most lovely guest coming, Hannah Miller. And we've titled this, Stand in Your Power and Own Your Story. And for those of you that have been following me for some time, I talk about the 5 foundations to health. I talk about sleep, movement, rest, nutrition and connection. And we do a lot about nutrition. People always want to talk about food, but actually the connection piece is really fundamental and foundational to health. That connection with self, that connection with other people, and that connection with that sense of purpose. And there's really good science that actually when we get that wrong, it manifests in our body, probably through the stress response. But when we get that right, when we're really mindful and connected with self, when we're in right relationships, and when we have that sense of purpose, it can really improve health and longevity. There's some lovely research that actually shows that probably one of the best things that you can do to live long is have a healthy friend. So this next webinar really is to address that situation. I don't know whether you're like me. I've got 3 kids. I'm running my own business, and life's busy. And sometimes when I just try and connect to myself, like I'm so busy and so distracted, I don't even know how to stop, and I don't know how to connect. And I've learned a lot in my own life and learned a lot in coaching my patients about how to help people get present, how to help people become the best versions of themselves. And Hannah Miller's coming, and she's the founder of her company Sidekick, and she is a Strength Finders coach. And I think part of that becoming the best version of yourself is having tools to understand how you're wired, and what you love doing, and operating from a place of strength. So I'm going to be interviewing her to get some tools that we can use so that we can go in this journey of becoming healthy and whole, covering all of those foundations. So do sign up for that. And we also have I do webinars every so often. There's 6-week courses. I take small groups of 15 people. We do an hour a week, hour and a half. And the next one that's coming up in May is about how to balance your hormones and flourish. And this is looking everything from food, sleep, how we detoxify, how our hormones work, and how to get that balance. And you can sign up for that as well. And if you are looking out for where to find me, there's my website, drsallybell.com. Best place to find me on social media is Instagram. My handle is Dr. Sally Bell. That's where you're going to get a conversation, a response, but I am on Facebook and all the other things. So brilliant. So, and finally, this isn't a sponsored event. So Dr. Catherine Steele is going to talk to us a little bit about Welada. I'm not sure if I said that right, because that's some of the products she's involved with. And I'm going to mention some other products too, but really, it's really important to me as a medic that I remain independent. And so because I want to keep your health as my primary concern and try and not bring cognitive bias to some of the the research that I'm looking at. So although we mention products here and go and use them, there's no financial gain to me, and it's not a sponsored event. So, why do we need a new approach to skin health? I mean, we have these two competing perspectives. We have a medical perspective that wants to use a medical model to deal with skin issues. And then we have a lot from the cosmetic and the skin industry wanting to sort of treat things from the outside in or using supplements. Now, from a medical perspective, if you came to me 10 years ago, the way I am taught is that I am taught to medicate illness, to diagnose an illness, and then follow a guideline that is often very heavily weighted towards medication. There's often reference or sort of tick box exercise around lifestyle, but really there's quite a strong emphasis on us as doctors to prescribe. So come in with your eczema and it's going to be steroid, and it's going to be emollients. You're coming in with your psoriasis, it's going to be steroid based skin things, possible referral to the dermatologist for drugs that suppress your immunity. If you come in with acne, there's various skin things we'd use, antibiotics on the skin. We might use oral antibiotics, and then we might even refer you on to a dermatologist for a drug like Roaccutane. And the problem with that approach, as I've talked so many times, is that when you look under the cover of our bodies and look at what's causing all of these chronic illnesses that we're struggling with, while 10% might be to do with our genetics that we're getting from our parents, like 90% is to do with lifestyle and nutrition being part of that. And as medics, we're not taught about lifestyle, we're not taught about nutrition. And so we don't have that approach. The other issue when using the medical model is this kind of silo approach. Oh, is this silo approach to health where which has its place, but we've got a skin doctor, we've got a liver doctor, we've got a gut doctor, we've got a knee doctor, we've got a ankle doctor, we've got all these doctors that are specializing, which is brilliant because it brings great care with that specialization, but we've lost that ability to hold the body together, and we've broken down our body into all these different parts. And really, it isn't scientific because we are an integrated web of connections, and things are very much overlap, and especially with our understanding of gut health and how that impacts skin, hormonal health impacting skin, but all those other things, we need to look at a whole, and we're not taught that that way. And then finally, again, we in the UK, we have a wonderful health system called the NHS, and it's brilliant for what it does, but it isn't set up for these lifestyle diseases. It's very a sort of disease model approach, and it's great for acute care, it's great for specialised care, but it hasn't got the room to deal with lifestyle diseases, and we cannot keep medicating that. We need a lifestyle approach. And so I know many of you will go, oh, and here she goes again, but it does come down to some of these key foundations that underpin all health. Getting sleep, getting rest, getting nutrition right, getting movement right, and getting our connection with self, with others, and sense of purpose. And these are some of the key foundations that tap into our innate brilliance to rest and to heal and repair. And then I think, when you start to look at the cosmetic industry, and the skin industry, I mean, this has been a big eye-opener to me, partly because I've got 3 girls, and I must confess, I don't really have a skincare regime. And so I'd always just ignored the issue. And then with my girls, wanting to use creams and cosmetics and having problems with some teenage spots, and I really started to sit up and think, well, what is in this stuff? Like, our skin is one of our largest organs in the body, and we absorb what we put in it. And I was really surprised when you started to dig a bit deeper about how unregulated the beauty and the cosmetic industry is. It it depends. It's very different in different countries, but here in the UK and certainly in the States, it's very poorly regulated. And you start to see in the WHO sort of probable carcinogens springing up about certain products that are used in skin creams, so possibly causing and contributing to cancer and disrupting our hormones. And so so that when I started sort of digging a bit deeper, there were things like mercury and lightening creams, phthalates in many sort of synthetic fragrances, and all these chemicals, some of which are really difficult to see. And if you've ever looked on the back of a bottle of like your toner, you can hardly see what's in there anyway. All these tiny words are very difficult to understand. And it became an increasing concern to me. Just a great resource for you on that. This is an American-based organisation, the Environmental Working Group, and they have a consumer's guide called Skin Deep. It is about American products. We do have different laws here in the UK, but it's really helpful in untapping and understanding what's in our products, what to look for, and certainly helpful for American products in around choosing good products that are clean. And so we ended up, people kept asking me often in some of my other webinars about skin and what to put on skin. And it just got to that point where it's like, right, we need to do something and talk about this, because I feel really confident talking about it from the outside in, but I was less confident about talking about skin products. And so Dr. Catherine Steele is going to talk a bit about that in the second half of this presentation. I'm going to ask her some questions, and then we've got question and answers at the end. I've had a few people write to me already. So just let me take a quick drink. Fab. So my inside out approach, I've tried to do it in just 9 slides, and some of it is the same old that I keep talking about. Now, before I talk, it's really focused on nutrition tonight, but before I say that, sleep and managing our stress, it's massive for all of our health, but it's also important for our skin health. When we are sleep deprived, it's very pro-inflammatory. It suppresses our immunity. It takes us out of that rest and repair state. And when we're stressed, again, it's very pro-inflammatory, suppressing our immunity and all those lovely functions that need to happen to keep our skin healthy. Happen when we are in that rested state and we're not stressed. Stress is fine, but we need to close the cycle, and we need to have adequate sleep. So although we're going to look at nutrition, you cannot out eat the fact that if you're sleep deprived or if you're really, really stressed, you have to look at this in a whole approach and be looking at these foundations to create that environment for our skin to flourish. That said, I think my first point really is about getting off ultra-processed food. And I think if I had real skin issue that I was facing, regardless of what it was, regardless of whether I was, somebody was coming to me with psoriasis, an autoimmune disease, or whether it was dry skin, or whether it's acne, the first thing to do is I'd probably really put them on a reset, where we get industrialized sort of seed oils and getting sugar and getting the ultra processed foods out of the diet, and really packing their diet and never have to go hungry, getting good fats in, getting good sources of meat and vegetables, whole foods, nuts and seeds, and just really kickstart, that first month of working with the patient, of getting into real whole foods. One, because it's going to do amazing things for our gut bacteria, which is very important for our skin, but also it's going to give our body a lot of the nutrients that it might be deficient and struggling to calm down inflammation and struggling to mop up some of that oxidative stress that's going on. And so really packing the diet with good nutrition is probably where I'd start, and just doing almost like a reset and blitzing it that way. That said, there are some real key nutrients around skin. I'm picking out some of them. There are a few I'm not going to mention, but if you're going for a whole food diet, you're going to cover these. So vitamin A is really important for cell turnover in our skin and really important around our immune function. And I had somebody actually, if you emailed me today with a picture of your upper arm, and it's got that kind of keratin sort of plugs where it's kind of thick and a bit scaly, and you can see all of the little hair follicles. That's quite a classic sign of vitamin A deficiency. So it's a sign that you need more vitamin A. And so, it manifests with this kind of dry skin, these keratin plugs. And vitamin A is found in, it's really, liver covers so many of the vitamins that we need. I hate it. It just makes me gag. But if you can tolerate it, and if you're a meat eater, getting some liver from really good source, so grass-fed, regeneratively farmed, is going to literally tick most of the boxes of what I suggest next. But egg yolks also really rich in vitamin A, cod liver oil, grass-fed dairy, remembering that what we feed our animals impacts their health and impacts our health, and kidneys as well. We can touch on sort of vegan and vegetarian options too in a moment. The other is zinc. Zinc also is very important for our immunity, and it's really important for wound healing. Also offers some protection against sort of the damage from UV light in some studies, and really good for calming down inflammation, which we'll often get in skin conditions. And again, look, liver's up there again, but sort of red meat, shellfish, scallops, pumpkin seeds, also really rich sources of zinc to boost in your diet. Vitamin C, very, very important. So collagen is kind of the proteins that hold the structure in our skin. It diminishes with age. Often it's the thing that helps keep us wrinkle-free, and it needs vitamin C in order to sort of regenerate and be strengthened. And also vitamin C, it's a really potent antioxidant, so really good for protecting us against the radiation from exposure to sunlight. Not an alternative from protecting your skin with sunscreen, but really important in terms of limiting damage. And your vitamin C is found in all your fruits and your vegetables. These ones are that I've listed are just really rich in them. So and also a lot of these different coloured vegetables, especially when we get them organically, have wonderful other phytonutrients that are going to work their magic in your gut and your gut bacteria. Fatty fish is another one. And this is all about balancing inflammation and balancing our omega-3 fats. And omega-3 fats, particularly EPA and DHA, are really deficient in our modern diet. And probably the deficiency is one of the leading causes a lot of chronic disease. And you have to be careful about fish, about where you're getting it from. Very large fish can have contamination from heavy metals. But I use an acronym SMASH, so sardines, mackerel, anchovies, salmon and herring, all these kind of smaller fish. You really get a lot of the good omega-3s in them, and also they're a lot cleaner in terms of heavy metal toxicity. And now, if you don't eat fish, if you're a vegetarian, if you're vegan, then I think this is the one of the areas you have to supplement. So I've got one vegetarian daughter, I've got another who won't eat fish, and it's one of the things that I always supplement with them. And it's about balancing inflammation. So inflammation is a process in our body. If we cut ourselves, it goes red and gooey and it heals up. That's inflammation, fantastic. But over-inflammation is really problematic in all chronic disease, but also skin conditions. And balancing those omegas is really important. And that's why I say get industrialized seed oils out of your diet, your sunflower, your safflower, your cotton flour, because they're very high in omega-6s, which are not bad in themselves, but too much upsets this inflammation equation. And so we need to address that balance by removing the industrialized seed oils and balancing it with those good omega-3s. I always think in gut when you're thinking about skin. And again, we can talk about this. People have asked me about rosacea, which is a skin condition with flushing and kind of a kind of type of acne that you get in midlife, and I'm convinced it is primarily a gut issue and a skin microbiome issue. So focusing on gut health is really important, and fermented foods is a way to do that. It's a way to get good nutrition in, it's a way to get good bacteria into your gut. But gut health in itself is a huge topic. We've touched on it before. We're going to be doing another one in a few months just on the gut microbiome, and one of my courses is a 6-week course on gut health, but I touch on it because it might be the fundamental thing for you in terms of improving your skin. If you have a lot of gut issues, it might be the best thing is just actually getting help to resolve the gut, because often as you get the gut better, a whole host of things start to improve, including skin conditions. Just also a note with fermented foods, if it makes your skin loads worse, it might be a signal or a sign that actually you have a problem with histamine, and having a discussion with somebody about that and looking into that can be really helpful. I'm a great believer of bone broth, so it contains some amazing amino acids. It contains amazing minerals and vitamins. It contains lots of collagen and gelatin, and it's great for gut health. It also has lots of the building blocks to calm inflammation down. That's good for the structure of the skin, of the health of the skin. So, and then finally, things that I would consider eliminating, like I have lots of people that come to me in clinic and they have got in a right pickle about all sorts of foods, and they've tried eliminating this and that, and it's caused a lot of tension and a lot of anxiety. So I'm careful about talking about eliminating foods. It needs to be done well and often needs to be done with support. But with skin, I think dairy can be an issue, although I'm more convinced that actually fermented dairy is fine. It's kind of when we pasteurize it, but dairy can be an issue, and also gluten can be an issue, especially if you've got other issues like aching joints and fatigue, as well as skin issues. Trying a trial without gluten can be really helpful. And I'm not talking about celiac disease, I'm talking about non-celiac gluten intolerance. And the really, really important thing, if you're going to try and exclude something, and those are probably the two things that I would consider excluding as my next step. The really important thing is remembering the 3 R's when you're excluding anything. And that is, it is, oh my goodness, I've forgotten what it is. It is remove, record, and reintroduce. My goodness, I've been in clinic all day. And it's really important that you do those. So you remove it in every form for 3 weeks. You've got to remember the 3 R's, 3 weeks. And you don't just think, oh, well, it's Saturday, I'll have something just for that morning, I'll do it the rest of the time. It doesn't work like that, because you can trigger the whole reaction again. So you remove it completely for 3 weeks. You record what's going on. Are your symptoms that you're trying to improve improving? And then after 3 weeks, you reintroduce that single food that you've eliminated for 3 days, and you look to see if it makes things flare up. That's almost the gold standard for working out whether you've got a food intolerance. And the testing, some of the testing you have to handle really carefully and have to interpret well. And really that is the gold standard. And it is worth it if you feel like you've tried everything, you've done the whole food thing, and you're really trying with your gut health. That's probably the things I would look to eliminating to see whether that improved your condition. So fabulous. We can have lots of questions at the end. I'm going to introduce Catherine now. Just let me get my screen up. So Catherine is an associate professor in psychology, how exciting, but also just has a passion around clean skincare. She's also a functional medicine coach, and so I'm just going to ask her some questions, and she's going to help us explore this whole issue of inside out. So where are you, Catherine? I'm going to pin you, so I've got you on the screen. There we go. Welcome. Thank you for giving me your time. So
thank you.
So I would just love to hear just a little bit about you. You know, have you got kids? You know, what's your life situation? What work you into? So you start.
Okay, I mean, as you said, I'm an associate professor of psychology, so I'm based at the University of Leicester, and really my work there focuses around well-being. That's my sort of area of interest for teaching and for research. About 5 years ago, I trained as a functional medicine health coach. So all of those things sort of combine really this focus on well-being. And like you said at the start, you know, really trying to help people become the best versions of themselves.
Yeah.
A bit of a sideline, I guess, to that has sort of developed a passion really for clean skincare. I guess that sort of developed really. I mean, I have got my daughter's 8, and I think when she was born, just being really aware of what you're putting on a baby's skin, you know, and there was quite a lot, I think, in the press at that time about some of the things that were in baby products, and it just caught my eye. And from then it was just sort of this research project to try and learn more about these skincare products. And like you say, it's such a minefield, and you can go down so many different rabbit holes with it. And so I think that was really what sparked my interest, just thinking, what am I bathing her in? What am I doing to her skin? You know, what am I putting? She's got this precious sort of baby. And you know, you just want to be really careful. I think that's really where it came from.
Yeah, I mean, it was really shocking for me, I think. Oh gosh, sorry. It was really shocking for me just about the whole absorption thing. And, you know, even when you look at a baby that comes out in utero, you know, last year there was a study showing, you know, over 270 different chemicals within that umbilical cord, and over 200 of them being neurotoxic to the brain, and realizing they're starting this life, like actually because of all the chemicals we're exposed to, they're exposed to in utero. And then this, it didn't occur to me until, I'm not joking, 3/4 of the way through my career, oh gosh, you know, I get people to put stuff on their skin to absorb the medication. You know, what are we doing? You know, putting all these other products on, and what are, you know, in those products. So what you're involved with Welada now? Tell me about that. And
yeah, so I work with Welada as what's called the role as a wellbeing advisor. So basically, my role with Welada, and I guess we'll talk a little bit more about them at the end, is to advise people on changes that they can make to their skincare regimes. It is to advise on products that Welada do, but we also kind of advise on lifestyle as well. They do sort of anthroposophic medicines as well, all, you know, designed to kind of, the whole principle is around sort of harmony with nature, so keeping people in harmony with the world around them, and their products are all based around that as well. So we do one-to-one skincare consultations, which that's being done online now, and just to teach people about how to care for their skin. You know, it's you know, one of our biggest organs, isn't it? And it's the protective layer that we have. So, you know, keeping it in tip-top condition is just so important, isn't it?
Yeah, and from your perspective, like what you know, should be people be watching out for in the products? How do they educate themselves? You know, you look at the ingredients and it's overwhelming. Even with me having done my research, I look and I think, my kids go, is this okay? And I'm like, oh gosh, you know, I don't know. So how do we navigate that as consumers and make good decisions?
You mentioned the environmental working group at the start, and I printed this off. I know you probably won't be able to see it, but if you go to the environmental working group website, they've got a fantastic download, and you can sort of, it's very good if you've got kids, you can cut it out. It's got lots of dotted lines to make it fit in your purse. And it's just a really handy guide that literally is designed to be wallet size once you fold it up, and it's got the products to avoid for children, skincare products, how to pick safer products. So, you know, literally as you're staring at the aisles or staring at the online site, wherever you're buying things from, you can use that to kind of tick off products and the ingredients that you might be looking to avoid. So top ones, the thing is, there's been quite a lot in the press about parabens and phthalates that were sort of known to be hormone disruptors. Disruption of hormones in itself, as you said, Sally, affects the skin. So it's just a vicious cycle. You're buying things to rebalance your skin that are actually potentially making the problems worse. A really big one is sodium lauryl sulfate. So that's what gives us bubbles in our products. And one of the biggest criticisms of people when they move to more sort of natural skincare is that it's not as bubbly. You know, your bubble bath's not as bubbly, your shower gel doesn't foam, your shampoo doesn't foam. And the reason it doesn't foam is because it hasn't got SLS in it, which is known to be a skin irritant and something that dries your skin out. So yes, it's a bit of a shift sometimes moving to these products because they feel a little bit different, but that's because they're working very differently in a good way. You know, long term in a good way.
toothpaste, and because I had an issue, I was told I got geographical tongue, and I'm always getting this sore tongue, and it was a real switched on dentist who just went, oh, it'll be your SLS in your toothpaste. And I went, what's SLS? So this was like 10 years ago. And and yeah, and so switched my toothpaste, never had a problem since. And it's amazing what is allowed in our products that actually my kids would swallow that, you know, and it's not licensed for ingestion, it's only a license for external use. So yes, go on. So I'm really interested.
That's what's really interesting though. I mean, you mentioned, I mean, they estimate between 60 and 80% of what you put on your skin is absorbed, and it's absorbed without a filter. So it's not something that you're breathing in, which your respiratory system's filtering. It's not going through the gut's not filtering. It's literally being absorbed directly into your body. And I think one of the most frightening things for me recently within skincare is the use of nanoparticles. So cosmetics industry are using nanoparticles more and more, and they don't have to declare that in their labeling. So these are 4 times smaller than a red blood cell. So they are designed to get into this, to be absorbed. They're designed to be absorbed into the body, and we have no idea that they're in our products. So
and what is a nanoparticle? What do you mean by that? Is that just the measurement of anything? So it could be
the measurement of anything, be it a fragrance, be it you know, we use sort of collagen and retinol in skincare products to try and boost the skin, particularly in anti-aging products, and they're just making them really, really small with the idea that they can be absorbed much more easily. But it's what is it that's being absorbed? You know, what is the chemical compound that's been produced? Has it been safety tested? Has it been medically tested? And as you say, the regulations are just so different to how they would be for medicines and pharmaceuticals. They're just, you know, the licensing is just such a different process.
Yeah.
You know, we talk about this, you know, skin being our protective layer. The skin biome is the first line of defense as well. So we really need to just make sure everything's balanced. And the more chemicals, they estimate that the average woman, by the time they, you know, sort of the old days when we used to go to work, has used between 10 and 14 products with over 200 different chemicals. And that's by the time we get the acid morning, which is terrifying.
Right, and just to mention that might be new for some people, you know, so the skin has a microbiome, doesn't it? Do you just want to explain that? Yeah,
so there's millions of sort of microbes and bacteria that are living on our skin, and they're there to protect us from what's going on in the outside world. So, you know, we need to have this sort of protective layer. So if we're exposed to things when we go out and about, our bodies are designed to sort of care for themselves, aren't they? And if we have skin that's healthy, it's got a good level of oil base in it, it's got a good, varied, diverse biome, just like within the gut, then it will protect us against, you know, if we touch something, and that, you know, it's that first layer of protection. So if you touch something that's got bacteria on or got a virus on, then, you know, the skin biome is that first layer of defense.
Yeah,
and it's just being destroyed by things.
And what can we do to nurture our skin microbiome?
It sounds a bit crazy, but less is more. We're quite obsessed with washing these days, aren't we? You know, and I don't just mean since COVID. I mean, 15, 20 years ago, if we asked our parents, they didn't shower every day or twice a day. You know, our grandparents might have had a bath once a week, you know, and that was enough. And they were very physically active, so they were moving and they were sweating, and they, you know, and I think, you know, and I know it's a strange thing to say, but I really think less is more. You know, the more we keep washing the microbiome, we're actually washing that bacteria away every time we wash. So if we're doing that, we want to be putting the oils back in. We don't want to be taking more out by using sort of oil stripping cosmetics on our skin. So definitely less is more.
Okay, great. And what other things have we got on that list there? I'm fascinated. Keep going. This is brilliant.
Well, we talked about parabens. We talked about some. The other one is aluminium, which was again sort of found in deodorants, and there's a big difference between antiperspirants and deodorants. So I think quite often with skincare, we tend to think, particularly as women, about facial skincare, but it's not. It's what goes on, you know, in the whole of the body. And an antiperspirant is designed to actually stop us from sweating, which is kind of quite interesting because that's sort of a detox process. Whereas a deodorant is designed more to mask any smell from sweat. So it's interesting to think about, what are you trying to achieve there? Is it the odor that you're trying to sort of get rid of, or are you actually trying to stop yourself from sweating, which could be stopping some of the detox pathways in the body. Antiperspirants do tend to have aluminium in, which again, has lots of problems within the body. It's not designed to be, in the body, and you're putting it in a very sensitive area under the armpit, into the lymphatic system. So there's again quite a lot of research on some of the damage from using antiperspirants, as again on a daily basis. You mentioned triclosan. So lots of us now using hand sanitizer with sort of triclosan alcohol. Again, really stripping away that sort of microbiome on the skin and drying the hands. If you have a look sometimes at your hairdresser's hands, quite often hairdressers typically really suffer with very, very dry skin on their hands and with eczema. And again, that's probably because of the chemical exposure. Quite often they may wear gloves. You might notice your hairdresser wears gloves a lot because the products that they're putting on it are so damaging. And then we're putting them on our hair and on our heads and on our scalps. So it's just really thinking, isn't it, about what are we putting on our bodies and what do we need?
Yeah. I was very, very grateful last week, having gone for
I mean, I'm two-tone, so don't get me wrong, I'm not perfect. I cannot wait to get the highlights back in, so I'm not, not perfect. Yeah. But it's about minimizing, and you said balance, isn't it? It's about balance.
Yeah. And so what, in terms of that kind of daily regime, so as I've already confessed, I've just never had one. I have just always used water. I often don't use anything in the shower but water, and partly it's just been laziness. And it wasn't me being healthy, it's just I never got round to it. But I do have my girls now, and they're asking about a skincare regimes, and what is a healthy approach to skincare, and what should we be doing, and what should we be advising our children to do? What would your advice be on that?
I do think it's very individual, and that's not a cop out. I think it depends on what you're doing, where you're living. If you're living in an urban area and you're living along a sort of polluted path, and you want to be cleansing the skin morning and night to just try and take some of that away. So you want to be cleansing, just to remove some of those irritants that you might be experiencing. If teenagers, particularly, you're talking about teenagers and children, when you start to get breakouts, oily skin, increase in the oil in the skin, acne, then don't squeeze them. Again, don't overwash, because the more you wash, the more you're washing the oil away. So your body then responds and makes more oil, which creates more spots. So again, you're back in that sort of vicious. You want to kind of wash it away. You want to treat it, but very often just sort of leaving it. And one of Welada's principles actually is sometimes when you switch to a natural skincare routine, you do see flare-ups in your skin, and their sort of belief is that that's the sort of rebalancing process. So all the time you've been using harsher products, it has been damaging, and the damage might take place over the longer term. So it might kind of be under the skin, and then when you start to remove that, it starts to sort of appear. So it might take a month or so just to resettle. So sometimes if you do switch, you may have a bit of a reaction. But it will just take a little bit of time to settle down, and your skin's just trying to rebalance itself. Your body's working all the time, I believe, to rebalance itself and to try and do what it needs to do, and we kind of hinder it sometimes by some of the things that we do in our day-to-day lives. So you're looking at sort of cleansing to remove the dirt, and then you might want to sort of tone in terms of just improving the skin tone, and then moisturizing depending on your skin. But the skin changes every 7 years. So again, Welada don't talk about skin type, they talk about skin phases. They're suggesting that actually in different phases of our lives we need different skincare products, and it doesn't necessarily relate to age, it doesn't necessarily relate to dry skin or combination skin. It's more about how we mature, how we change, and that's not necessarily a linear process. Your skin can change for all kinds of reasons: hormonal changes, environment changes, and about 60% of what happens to our skin is age related, but about 40% is health and environment. And I think that's really interesting, because again, it shows we've got quite a lot of control over what we can do and what impacts our skin. I mean, you were talking about nutrition, sleep, stress. You're not just automatically going to become wrinkly and dry and thin skin at a certain age, because that's set in stone. It has so much impact on what else we do in our lives that affects how our skin ages.
I mean, the anti-aging, I keep getting a re thing. The anti-aging research again exploding onto the scene, and it's a really exciting thing to be following. And again, quite a lot of my ladies keep going, when are we going to talk about anti-aging? Because there are things that we do that switch on anti-aging genes, and and also there's the whole research around glycans now, and realizing how protective they are for aging, and glycans are just these little sugar switches that sit on our genetics, and our lifestyle impacts them, and we lose them with age, but actually we can almost reverse our biological age by our lifestyle, by how we're eating, by how we're living, managing our stress, cold therapy and light therapy, and there's just so many things that we can be doing that that can reverse that process. I mean, what are your top tips around looking after your skin from an aging perspective?
I think I would probably go bizarrely, because I work with Welada, but I would always say it's lifestyle first. I think sleep is really important for aging and for the skin and how the skin looks in terms of aging. I think you need to, if moisture is being taken out of your skin, and I think it is for all of us, in terms of even central heating through the winter is drying out our skin. So you want to use products that have got really, really good natural oils in them. So, for example, Welada shower creams. They're not these foamy sort of clear liquids. They're creams, and they've got a really high percentage of natural oils in there. So when you're putting them on your skin, they're actually putting good quality plant oils back into the skin and supporting the microbiome, because they're natural based products. So those would be sort of top tips. Again, in the face, you want to be putting in things like serums. Again, natural product. EWG, Environmental Working Group, kind of recommended serums. Soil Association actually has a beauty standard as well. So that's a UK standard, which is really interesting. That's kind of developing. And there's also a European standard called Natru certification. So if you're looking for products with either the Soil Association beauty label or Natru certification in Europe, then those are good ones to sort of look out for, because they guarantee a high percentage of natural products.
And that's Natru, N-A-T-R-U.
UE, N-A-T-R-U-E, yeah.
Okay, fab. No, that's really helpful. And I think the other thing, what in terms of our exposure to UV light, are you pro using, sun creams? What are your thoughts on that?
It's a funny one, isn't it? Because we know that vitamin D is good for us. Vitamin D from sunlight is fantastic, maybe particularly first thing in the morning when it's not too strong, depending on where you are in the world. I mean, funnily enough, our Environmental Working Group don't actually recommend an SPF over 50. So they look at kind of the lower SPFs and actually, sitting in the shade, maybe, wearing a hat, minimizing exposure to hot sun. But I guess, some people can't do that. So, again, it's this individual approach, isn't it? But, I wouldn't reach for the higher SPFs, and I don't wear one all the time, but I know some people very much do and feel a need to.
Yeah.
You can use there are nanoparticles in sun cream. Actually, that's another bit of a bugbear of mine. So my little girl, bless her, when she's homeschooled now, but when she used to go to school, they lather the kids in sun lotion. I would always send her with it was one of these ones that the white stays on, so she'd look like a little ghost when she came home, bless her. But that was because the ones that I was choosing didn't have the nanoparticles in, so it gives you this very chalky white look. So you don't need very much. And of course, her teachers didn't realise that, so they were lathering it on like everybody else is. And she was just like a little ghost when I'd pick her up. But you can get sun cream without the nanoparticles in, but it is whiter. So it does give a bit of a chalky look.
That's fab. And Welada's story. I mean, I kind of vaguely remember my mother kind of having a fern kind of green bottle of it. But so tell us a little bit about the story, and I'm going to mention products too.
Yeah, it's their centenary year this year. So 1921 they started. So they're really, really well established as a natural they're the oldest natural certified natural cosmetics company. So they were started in Switzerland and Germany. So that's where they sort of started. So strong kind of European history. And all their products are biodynamically farmed. So they kind of describe that as one step up from organic. So, using moon cycles and sort of planting cycles and, all on organic land. In the UK, their base is in Derbyshire, where they've got 15 acres of land, and they grow over 300 plant medicines in Derbyshire. And they have an open day every year. Obviously, we haven't been able to do it this year, but they do have an open day for the public where you can go and have a garden tour with Welada, which is just a fantastic event. And everything they do, you know, their values are all about sort of nature. So every single part of their products are all biodegradable. So anything that's going down the plug hole in your shower isn't going to cause any harm to sort of rivers or aquatic environments. It will all break down. All their packaging is recyclable. So just a really, really ethical, sustainable company that are genuinely focused on health and well-being. You know, they are a product company that tell you not to use too much product and tell you to sort of minimize what you're using. So I think they've got a sort of fantastic value in what they do.
Great. So I've got a couple of questions for you. So from Amy Harris has put here, some companies provide products that are pure chemical, like 100% retinol, 100% niacinamide. You know, what do you think about you know, this? Is it counterproductive? What are your thoughts? Or should we be blending?
I would probably, yeah, my personal, you know, I would choose to avoid them. You know, unless it's difficult, isn't it? Unless you have a sort of skin condition and you feel like you really need to have some sort of chemical intervention or maybe an antibiotic intervention. There's all sorts of ways that we sometimes need a little bit of help. But, you know, on the whole, I think if you can take more of a natural approach to supporting your skin, then that would be my preference, rather than using 100% chemical product. Although I suppose everything's a chemical, isn't it? It's it's a trick one, really. Yeah, synthetic chemicals I would avoid. Yeah.
And what about toothpaste? Do you have one you recommend? I know the one I use, but
yeah, well, Welada do toothpaste, so I've yeah, but I mean, I use those and that I've used those for a long time, and they actually have a salt toothpaste, which is incredible. It sounds really bizarre, doesn't it? A salt toothpaste. It hasn't got mint in it at all, but it's sort of salt based, and I think it's really, really good. They do mint ones as well, but yeah, the salt toothpaste I really like.
Right, I use an aloe vera one, so
yeah,
I think that because mine's also fluoride free, because I think with adults you don't need the fluoride, and you know, fluoride's a heavy metal, well, it's not heavy metal, it's a metal, and you know, can oppose thyroid function. So it's just one of those things where you think, well, I don't really need it. Probably in children there is some research suggestive that it's beneficial for kids' enamel, and but yeah, so let me, I'm just having a look.
There is a whole range of I don't know whether you've seen them study probiotic toothpaste as well now, which is sort of supposed to help the oral microbiome, but I can't find one of those without fluoride. So if anybody can find a probiotic one without fluoride, then let me know, because I'd love to know that. Find one that does that.
I mean, that's another lovely area to have somebody on and discuss, you know, the whole microbiome and its link with disease and the need to get that right, which again is to do with lifestyle. It's to do with eating real food, getting agrochemicals, getting some of the synthetic chemicals out of what we're exposed to, and you know, nurturing, you know, our mouth microbiome as well. So it'd be a lovely one to have a discussion on. Let me just quickly looking here. So would you remove, this is for me probably, would you remove gluten and dairy at the same time or at once? So if I tried somebody on a whole food diet and you know, things aren't improving, or if there's a lot of gut issues as well as skin issues, and you know, maybe some aches and pains and joint issues, I would probably do them. I tend to do them at the same time. I've talked a bit before on gut health and a mechanism called gut impermeability, colloquially known as leaky gut. It's not a diagnosis in itself, it's just a mechanism, but there are links with gluten and leaky gut, which then can lead to these issues around skin issues and aches and pains and fatigue and brain fog. And so I will often take both of those out, but I would always do a reintroduction, with the exception of autoimmune diseases. So if I was treating with somebody's psoriasis, I might take gluten out longer term, but I'm not 100% convinced that gluten is actually the issue. I'm becoming more convinced that it's some of the agrochemicals that we're using and the pesticide residues that attach itself to some of these grains that actually is the issue with the gut. But that's complex and complicated, and we're not quite there. And I always think, you know, we take something out of your diet, we see how you go, we reintroduce it. If you feel loads better, oh my goodness, you know, great, no harm approach. There's lots of other ways to get good grains into you and good nutrition. So I think it's a nice no harm thing to do, but I would do them together. But you must reintroduce them separately, because then you don't know, you know, is it the gluten, is it the dairy? And the important thing is you reintroduce whatever it is, and actually do it blind, get somebody to sneak it in so that you don't know, because our brain can convince us one way or the other. So, and then, you know, you're looking for over 3 days after you've reintroduced something to see whether your symptoms that you're trying to resolve are improving. And then say it's made no difference and you've decided, oh, you know, gluten makes no difference. The next thing you would reintroduce your dairy. And I probably split dairy up. I would reintroduce butter for a bit, and then I'd do fermented dairy. So butter for 3 days, and if there's no reaction, then fermented dairy like your yogurt, your kefir, and then later I would do something like milk, because I'm also becoming more convinced that our issue isn't so much with dairy per se. It's when we've pasteurized it and we've lost all that lovely bacteria and some of the lactase and the wonderful things that we lose, that's the issue. Dairy is a beautiful food, hugely nutrient dense. I think the overall research, while it's conflicting, when you look at the whole body of research, I think it's beneficial to health. And I hate excluding whole beautiful foods like that. You have to think about what that cow's fed. You have to think about what it's been exposed to, as with all of our foods. But that's the way to do a good elimination. And particularly with rosacea, I would go down probably earlier, doing an exclusion with gluten and dairy and just seeing if that helps. And if you feel like it's improving but not quite there after the 3 weeks, just do it for that little bit longer. Skin takes longer to heal up. There's a cycle to it. But always do try the reintroduction, because then you've got your answer and you don't have to exclude a food group that is really beautifully nutritious and wonderful to eat, you know, unnecessarily.
Okay, I've got a question for both of you.
Yes.
If you have a minute to mention any vitamins or foods that, or advice on dark circle skin under eyes, please. So is there anything that you can recommend food wise or skincare wise that would stop us from having dark circles?
Yeah. I often suspect when people get really big bags, I often suspect food allergy or intolerance, and so would veer towards, one, making sure you're on a whole food diet, and then two, would consider some exclusion. And I would start with gluten and dairy again, but would be thinking more along, have you got some other allergies or intolerances going on? But what are your thoughts, Catherine?
I think from the sort of outside in, I mean, it's such a delicate part of the skin, isn't it? It's such sort of paper thin skin. So anything that you do put around your eyes, just make sure you're using your little fingers rather than, because we tend to sort of like do this, don't we, or rub our eyes, and you really try and avoid doing all of that. Really, if you are going to put any creams on, just make sure you do it with your little fingers rather than, you know, don't rub around that area too much. If you've already got dark circles, and I think as Sally says, there's probably something else underlying going on, but just don't aggravate it by kind of constantly rubbing them or really rubbing in different creams underneath. You know, again, less is more. I keep saying that, but you know, just be really, really delicate with that part of your skin.
Yeah. Brill. And I saw another question. So there's a question about vitiligo, which is where we lose.
There's a question that another word I can't say.
Oh, okay. So there's a question about vitiligo.
That's it.
Yeah. So vitiligo is where we lose the pigment, the melanocytes are the what give us pigment in our skin. And vitiligo is thought to be an autoimmune disease where your body's attacked that pigment and you lose it. And on the whole, it can eventually return. But far as I'm aware, I don't know whether Catherine's the same. I probably need to look at the research. I don't know whether I'm that up to date with vitiligo about whether you can regain pigment. I don't know, but because often it's just about using something to cover up, isn't it? Some of the some patches, and also being very careful with sun in that particular incident because of its risk around burning. Do you know good places to get products like that, or?
Yeah, I mean, in terms of sun care, I would always go to a company called Green People. Again, they're a UK-based company, but they do non-nano sun cream, which is, say, just bear in mind if you do use it, don't just put loads in your hand and rub it in, because it won't rub in. It sits on the skin. It doesn't get absorbed in the skin because there's still the anti-sunlight, the SPF blockers are not necessarily the best things to be absorbed by the skin. So that's how these products are really designed to be washed off. So they sit on top of the skin and give you a very slight sort of white, white covering. But yeah, Green People do those, and that's the one that I would recommend.
Yeah, there's a couple. They're not sure if it's a skin issue, but do you have any recommendations for someone who suffers from frequent cold sores?
So that's all about immunity. So we should do something. I've done stuff on immunity before. So you need to make sure you've got, good sources of zinc in your diet, good sources of vitamin C in your diet. You need to make sure you're managing stress. You need to make sure you're sleeping, because often the cold sore virus just lives in our bodies, and it emerges when our immunity is suppressed. So we've been stressed, or we're deficient of key vitamins, or we're not getting enough sleep. So there's quite a lot of stuff actually around at the moment about boosting our immunity, and also a lot of our immunity is in our gut. I go on again, it's all about gut health, but eating for that happy gut is just really important in terms of looking after immunity. But recurrent cold sores is often a sign that you're just a bit run down, and you need to be looking after yourself from an immune perspective. But it might be something that we could do, is look at immunity again.
I was told lysine works. If you've got lysine's the tablet.
Yeah,
you have
so
cold
lysine,
sores.
an amino acid that's is important in that sort of immune function. So there are a few things that you could use to boost immunity.
Okay, then there's somebody.
Can I give a really quick thing on the cold sore? And it's not about what to put on it, but just in terms of self-care, one of the tips that sort of I learned with working with Welada, many of us, when we feel really rushed and overwhelmed, we feel like we haven't got time to take things for ourselves. So you might not feel like you've got time to disappear for half an hour and have a bath. Foot baths is something I thought that my grandmother did, or I wasn't going to do. But actually, if you can just fill a washing up bowl with something really nice and sit in the evenings with your feet in a nice bowl of hot water, it's so relaxing. So in terms of, a bit of self-love and kind of caring for yourself, that would be my sort of tip in terms of just sort of reducing some of that stress.
And we absorb loads in, so that's where something like magnesium salts, Epsom salt, is wonderful. And magnesium's very, and good for sleep, good for anxiety. So I recently
lavender.
I had one of my ladies recently who just couldn't, she couldn't get in and out of the bath, but really loved her Epsom salt. So she switched to soaking her feet, and she says, I get the same effect. It's really beautiful. Yes. Can you recommend vitamin D supplements? So my opinion on this is, it's fairly conventional that we should all be on vitamin D supplements. Vitamin D is really important for our immunity, really important around recovery from COVID, not getting COVID, treating COVID. It's all part of that, because vitamin D is another key hormone around our immunity. And so I think if you go on the NHS website, it will give you the recommended doses for children. I don't do children so much, but for adults, I'll be looking for 1,000 to 2,000 international units, probably through the year. Particularly because we do wear sunscreen all the time. So, vitamin D is our sunshine vitamin. And if we have covered up, we're not going to be getting the levels that we need. And there's some lovely people, and I use BioCare or NutriAdvance. There's some great companies out there offering that. Right. So somebody, go on. Just there's a thing about some of the vitamins around vitamin A, zinc, and omega-3s and bone broth for vegetarians. So I don't think there is an option for bone broth, but there's the Vegan Society UK is a brilliant, really balanced, really helpful website, and so literally they have this thing: sources of vitamin A, sources of zinc, you know, they'll teach you about fermenting it and soaking it so that you can get through some of those anti-nutrients. So I would go there and just make a list of some of those key vitamins and look where that kind of fits in with what you like eating. And but the downside is that it's just meat products are more nutrient dense, are easier for us to absorb, and so they are denser and more richer in terms of the source of them. So you just have to work at making sure you've got enough in your diet from those vegetarian sources, and that some of those vegetarian sources and vegan sources you have to ferment or you have to soak to get or ferment to get those nutrients really bioavailable so that you can get the most out of them. But I would have a look on the Vegan Society for those lovely lists.
Okay. We've had a couple about what can they do about a wound that's not healing, and somebody was also suffering from leg abscesses.
Oh gosh. Catherine, wound healing?
I mean, I guess it depends on the cause, you know, in terms of what the original cause of the wound was, whether it's sort of recurrent ulcers or what, you know, what sort of thing that you're looking at. But it kind of says inflammation to me in terms of, again, I'm thinking more internal than external, but in terms of calming, if you're looking at things like sort of calamine lotion, you know, very sort of calming products, again, you know, I would certainly be looking for natural products there. So anything, because all you want to do is calm the wound. You don't want to add any irritants, anything to dry. You know, this and naturally it is going to take a little while. We've got so many different layers of our skin, so it will take sort of time, I think, in terms of sort of healing from the bottom up, because you know, you want it to heal well and heal properly. But if you're doing it naturally, you're not taking anything away to strip it away. You know, hopefully using calming products will help.
And I think, like, from an inside out approach with wounds, it's you've got to think blood flow. You know, is it not healing because the circulation isn't great? So blood flow is really important. You know, inflammation from the inside. So again, sort of balancing those omega-3s with those omega-6s is really important for calming inflammation. You know, in terms of, you know, some of those key nutrients that we've talked about, you know, there with your vitamin A and your vitamin C and your collagen, and, you know, are these in your diet? Has your body got them in order to knit that wound together? You're thinking about unwelcome bacteria that may be preventing healing. So there's a I think that's why I hesitate, because there's not you've got to be thinking about all of those things, which on the whole, you know, not smoking and you know, and having a whole food diet and really nutrient dense diet is going to really set you up for it to heal from a nutritional point of view. Yeah, so, but then products from the outside in. I remember I worked in Africa for years, and we used to use papaya skin and the inside of papaya skin, and it was the most amazing. And aloe would be the other thing that we would use naturally. We just didn't have any products, and it's all
you can
coming
get
back.
I think you can get Manuka honey patches as well now. It's sort of natural food stores and stuff will have in their sort of health section, will have sort of these patches that have got Manuka honey within them, and all sort of antivirals and antibacterials that are within that. So I know I think they're used in the NHS now as well in some places.
Raw honey is amazing and functional food. It's a prebiotic. It's wonderful for controlling your sugars. You know, it's great for immunity. It's one of those beautiful foods where it has so many functions. And yes, in the NHS now, they do use it on wounds that are difficult to heal to promote that. So yes, great. So I'm just having a look at those last few. Eczema around the eyes. Any thoughts on that?
Again, I would say you want to start by just stopping putting any sort of chemicals on that area if you can. Just try and I know it can be very irritating. So, you know, in terms, you want to get specific creams that are suited for the eye area, because anything else can be too heavy. So again, you're actually going to be making the problem worse, because you're actually putting too much sort of a product laden or too much oil within that area. So make sure you're using eye-specific products. Within Welada, they have a sort of almond oil product which is all about resetting, and it's pure almond oil, and they would use that for sort of resetting eczema on the face anywhere.
Going back to that ulcer thing, my dietitian who I work with has said vitamin C and zinc are beneficial, and make sure you've got enough protein. and also make sure you haven't got diabetes, because that will inhibit. Just I wanted to mention just some other products here in the UK, just that I have really enjoyed. So oh, I've gone dark, so just to get up there, because I want to make it fair. So Tropic is another one where seems to be very clean healthcare. Lots of advice there too. Another one that I really love, which is based in the Cotswolds, and this is a mother-daughter, where they use a lot of honey products therapy. Again, I kind of love how clean their products are as well. And what was the other one I put? Oh, and then Cherry Tree Naturals is a lovely one, where, you know, just she makes all her own stuff. It's fabulous, and lots of natural products. So just wanted to put those out there for things that I know, but very happy if people want to shout out and let me know things that they have found really helpful. So Catherine, any last thoughts, or how do people get in touch with you if they want to ask you questions?
Yeah, I mean, obviously I've talked about Welada tonight, but Neal's Yard is another one of the sort of original UK sort of natural products. So Neal's Yard do cosmetics as well as sort of skincare products as well, and all sorts of teas and supplements. So they're another fantastic company. In terms of anyone who's interested in learning more about sort of skin from the inside in, from the outside in, sorry, the other way around, or Welada's product range, then I'm on Instagram as Dr Catherine Steele, and my website's turquoisewellbeing.co.uk. So my email is just catherine@turquoisewellbeing.co.uk. I'll pop it in the chat as well.
Great. So thanks so much for joining us. Really appreciate it, and for giving us your time. And I've learned loads about skin products, and get a bit more confidence about what to recommend and what to look for. So just do have a look for that environmental working group little thing that you can print out. That's certainly where I turn to for a lot of advice around what's in our products. It is American based. Some of the laws over here in the UK are different. So there is a slight difference there, but it is really helpful. It's really geeky in research. So if you want to go and look up the original research as well, it's really helpful. And they look at all sorts of products, not just skincare, everything from our food to, house products and what have you. So really useful resource. So do sign up if you want to join me in a couple of weeks. Really excited to be having Hannah with us. Actually, it's just such a passion of mine, is that whole how to connect with yourself. So I do hope you join us. If you've got any thoughts, questions, I've just noted some people have put some ideas for other webinars, things to discuss.
Written down.
Yeah, we'll be thinking about launching some new webinars coming up. So, we're responding to what you want. So it's been great to have you, and thank you so much. And we'll see you again soon. So bye-bye.
Thank you very much. Thank you.
Thanks, ladies. I've saved the chat, Sally, so I'll send it on to you both.
Thank you very much.